Dr. Jaffe, why do we have two types of iodine in PERQUE Bone Guard Forte?
Boy, that's such an important question. Iodine and iodide, both essential, both needed in the human diet. And while a little bit helps avoid certain deficiency conditions, many people need a lot more than they're getting. And we have lots of evidence both of safety and efficacy, both in American medicine, where in the 1920s and 30s, the best of doctors, when they didn't know what else to do, they gave iodine, SSKI, iodine and iodide, two different forms, in a liquid, 10 drops, 20 drops, 30 drops, 50 drops a day. And they achieved miracles, that is, remissions without explanation. That's what a miracle is, in more than 1/3 of cases. Now, we know the placebo effect is about 1 in 3, so you have to be more effective than that to be independently beneficial. And then, of course, there is the global literature. People who eat a lot of sea vegetables or seaweeds, such as in Japan and other countries, can consume 100 times more iodine and iodide. You want both. They don't interconvert very easily. One you can think of as the mineral, the other you can think of as the salt, that is the one in solution. But they're both important in human health, in human longevity, and in amounts that we have in the PERQUE Bone Guard Forte by design. And we've had it there, as you know, Susan, for a long time, as Jayshree knows, for a long time. And among the other independent observations are how many people have done better, and no one has reported any adversity from the amounts of iodine and iodide in the PERQUE Bone Guard Forte. So we're confident, based on David Abrahamson's synthesis of literature, we're confident based on David Brownstein's monograph and easy read on the importance of iodine and iodide in larger amounts, and most importantly, our own direct observations, where we look very hard for adversity and are glad to report that when you use the biological forms of the nutrients, including iodine and iodide, as we do, you have a very high safety margin, a very high efficacy margin, and a very low risk of adversity, affliction, or toxicity.
And there's benefits to this dose of iodine.
No question that there is benefit. When you look at the healthiest long-lived populations, these are the people who live over 90 or over 100 years, almost all of them, for one reason or another, take in the amounts of iodine and iodide that we recommend.
And these are not too high, in your opinion?
No. See, this is a very important point, because the daily value is designed to make sure you don't have deficiency disease. But as we know, the daily value, or the old RDA, tells you nothing about need.
Right.
And on two grounds. A, human biology needs a lot more iodine and iodide than we used to think. And we have literature from the 20s and 30s that confirms how helpful, safe, and effective high-dose iodine, iodide combinations are. And it's hard to overemphasize the fact that the toxicity is remarkably low. It's water-soluble. The kidneys regulate it. That's urine, stool, and sweat is how it gets out of the body. So if you have a little more than you need at any given moment, the body will put it in something water-soluble for excretion. On the other hand, if you don't take in on a regular basis, I mean like a daily basis, the amounts of iodine and iodide that you need, now many parts of your body are under stress and do not function as efficiently.
Certainly, Dr. Abrams has a really thorough discussion of the history of the use of iodine and some of the amazing benefits. But I'm concerned about this concept that some individuals with iodine supplementation may develop Hashimoto's. I've heard it explained as a hidden Hashimoto's that becomes manifest when they use iodine. What is that? Just a mistaken? Was the Hashimoto's due to something else, or the high TSH due to something else? What's the thought on that?
Well, Dr. Abrahamson did indeed review the safety, efficacy, and need for iodine and iodide in regard to the question of thyroid function and pituitary thyroid relationships and feedback. Now I'm going to turn to my biochemistry background and point out that the people who you are reading, who are concerned about either unmasking or inducing thyroiditis because of iodine supplementation, in the common parlance, they do not know their elbow from a hole in the ground, because you must have iodine to convert the amino acid tyrosine into the T4 molecule that is the precursor that goes out to the body, and at the receptor where it's needed, an iodine is taken off and you make T3, which is the active thyroid hormone. That's also known as Cytomel. It can be prescribed as free T3. And so the notion that either iodine supplementation would induce thyroiditis is a post hoc argument. In other words, you start with people who end up with underdiagnosed thyroiditis. The average person with thyroiditis has the problem and suffers for 5 to 7 years before they are properly diagnosed. And now you say, okay, doctor, what does the Thyroid Society say about the impact of iodine supplementation on thyroid function? And in every society that takes in large amounts of iodine and iodide, they have less thyroiditis. So let's actually talk for a minute about what thyroiditis is and how to tame it. Thyroiditis is a lack of repair of the blood-thyroid barrier. And the anti-thyroid antibodies that people measure are produced inside the gland by the immune system trying to repair the thyroid and repair the blood-thyroid barrier. Now, if you followed our guidance, you would have a robust immune defense and repair system that would repair your blood-thyroid barrier, making thyroiditis, in the common parlance, put paid. You know, that's a United Kingdom phrase for saying undone. So yes, if you start with someone who has a variant of thyroiditis, and remember, there's Decker-Vane's thyroiditis, there's Hashimoto's thyroiditis, there's silent thyroiditis, defined by Bruce Weintraub, a colleague of mine in the 1970s when he was at NIH before he moved to Harvard, defined a kind of thyroiditis where the TSH is too high, the thyroid is underfunctioning, but the symptoms are not yet present, and it's called silent thyroiditis. So whether you consider each of the variants of thyroiditis a separate diagnosis, which is a choice, or you consider a continuum of thyroid health and function the way we do, you need a healthy blood thyroid barrier, which is controlled by your immune defense and repair system. And it turns out those very repair cells need iodine and iodide to do their job, not to make thyroid hormone, because it's made at the receptor in the tissues that need it by removing an iodine that was put on in the thyroid gland. So T4 gets made in the thyroid, goes to the body, gets converted to T3, and sets off all the wonderful energetics that healthy T3 do. Notice at no point was iodine or iodide mentioned except as an essential component to build thyroid hormone. Now, what is the thing that feeds back to the pituitary gland? The pituitary gland is sensitive to how much T3 you have. If you give excessive T3, you can drive the TSH to 0. I don't recommend it because a healthy TSH, at least according to the Thyroid Society, according to us, is 0.5 to 2.5. And if your TSH is elevated, that's a stress response indicating that the thyroid is being stimulated by the pituitary and not getting enough feedback because you're not making the T3 at the receptor because the cells are too acidic, because the cells lack magnesium, therefore they lack active ATP, and they can't function without the essentials. So since most of the people you are referring to do not know how to stimulate a healthy blood thyroid barrier, they do not know how to restore tolerance in the immune system,
Right.
and they use what are called post hoc arguments, which means after the fact, I see some devastation, and every time I see an auto accident, there's an ambulance. Therefore, I conclude that ambulances are somehow involved with auto accidents.
Okay.
No, no, that post hoc argument fails.
Okay.
So yes, I think it's very important for us to communicate the truth, the facts, as Dr. Abrahamson, as David Brownstein, as the giants whose shoulders we stand on. Sir William Osler used to give very large amounts of iodine and iodide, and we revere him today as one of the founders of academic evidence-based medicine. So when you clear away the confusion and you clear away the misunderstandings and you clear away what people say that isn't true, you're left with what we just talked about.
So on this iodine question, let me just ask one other thing. I was looking at the cross-cultural data, particularly about this use of iodized salt, and it's so confusing to me, particularly a Chinese study that Abrams himself quotes, that where they found an increased incidence of thyroid issues when they both Hashimoto's and other thyroid concerns when they iodize salt. Is there any association?
Wait, Susan, did you hear me say anything about iodized salt before? And I want to talk about it.
No, that's what I'm asking. Yeah.
Okay, so iodized salt means that they've added iodine,
right,
to salt,
okay,
to correct goiter. Now, goiter is something in the 1940s and 50s that we observed, and when I was a young doctor, we were taught to palpate the neck and see if the thyroid was enlarged, because that's what a goiter is.
right.
The gland enlarges. Why? Because the body needs more hormone. Why? Because the body is not nutritionally adequate.
Okay.
So, with regard to iodized salt, it is not a source of iodine and iodide that I recommend.
That's what I was wondering.
I understand, just to complete the thought, I understand that if you have a severe iodine deficiency and goiter, that iodized salt will prevent the goiter. That didn't mean that that was a healthier form. It didn't mean it was the form that I recommend. So I do want to distinguish for you and for everyone who watches this.
Yeah, that's right.
That the literature about iodized salt reveals the deficiency of commercial iodized salt. First of all, salt is sodium chloride, and you get too much sodium and too much chloride in the diet today.
Mm-hmm.
Adding an artificial iodine is not the same as what we're talking about. So
that's what I was wondering.
Yeah. So
please,
because so many people, they're, and I, on the one hand, I have empathy for this, but on the other hand, I am a biochemist, internist, laboratory physician. So I think we have to ask the right question the way you are, and then we have to be willing to take, yes for an answer, which in turn means that we have to look with our eyes, with our experience, with the experience of others. And because I'm at the midpoint of my life and career, I'm old enough to remember when I was told how safe iodine was. Then I was told how unsure we were of anything because of iodized salt.
Yeah, okay, I get it.
Which absolutely complicates, confuses, and shouldn't be confused with the facts.
Well, that's very important to clarify, because you'll see these studies saying, well, we looked at iodized salt. That's a very important thing to distinguish the form of iodine, and that salt is not the life-supporting 2 forms of iodine that the body needs.
That, and more importantly, they're treating the body as if it's a machine, and they're going to change one variable, the iodized salt versus non-iodized salt, ignoring immune defense and repair, ignoring neurohormonal stress, ignoring all of the things that to us are essential to understand the individual who comes with a thyroid-related issue.
Thanks for clarifying that. I think that's very helpful.
No, I'm glad you're asking, because most young physicians, and I define a young physician as any physician under 60 or maybe under 50, they have been taught superficially about nutrition, but not deeply. And when in doubt, just do nothing. And I happen to profoundly disagree with that, because when in doubt, dig deeper and find out the difference between iodized salt on the one hand and sea salt on the other, and healthy iodide from sea vegetables and other sources. And so now it begins to get clear instead of more and more confused or confusing, because we're able to distinguish the healthier, more natural forms, as we would always use in our products, with the semi-synthetic or synthetic forms that we actually, they're called workalikes, but I don't think they work, and I don't think they work more safely. In fact, I think they don't work and that they're more toxic.
That's very helpful. That really answers my questions about it. Thank you very much.